Hello and welcome to Checking the Vitals, a podcast powered by SpecialtyCare. I'm Todd Schlosser, and today our guest is Dr. Richard Chua, a neurosurgeon in Tucson, Arizona. In this conversation, we discussed how he bounced back after the director of the med school admissions committee encouraged him to seek out another career, why he chose to focus on neurosurgery, and how the past 20 years of surgical innovations has changed the way he practices medicine. Enjoy the conversation. So, Dr. Chua, I love to ask this question when we start out, and that is simply just, what was it through your young adult life, maybe even childhood, that led you to want to work in the medical field in general?
Yeah, it's a great question. So I actually grew up in a medical family. My father is a retired radiologist
Oh, okay.
and an educator. So he was the director of a radiology residency program for the majority of his career. So very early on, I really am kind of that nerdy kid that always wanted to be a doctor.
Okay.
And really because my father was my sort of hero and mentor, and that's who I aspired to be. So I always went to college with the idea that I would like to go to medical school and become a doctor. So had an excellent influence very early on from my father.
Yeah, and did he sort of encourage you to go into medicine, or was he, and I only ask this because I've talked to a lot of surgeons whose
Yeah.
parents were doctors, and they said, do something else. So I wondered if he also, encouraged you to go into medicine.
So he did encourage me to go into medicine, but only, as I remember him saying for many years, for the right reasons.
Sure.
Not to go into medicine because it's a high income career, not to go into medicine because it's a prestigious career, but go into medicine for the right reason, which is to take care of patients. And again, he led by example, and was very, very informative on creating the rationale and the reason for me to look into a career in medicine. I
talked with Dr. Deb German, who started a school of medicine in Lake Nona, if you're familiar with Lake Nona in Orlando. She's been doing this for a number of years, right? And she's seen that the type of people that apply to go to med school has changed to, it's less people who just want to make a good income, and it's more people who just have a life of, or a desire for service. And she thinks that that's because you graduate med school in a lot of cases with $250,000 student debt. And so it is a high paying job. That's still very true, but it may not be as lucrative, maybe is a better word, because of that debt you sort of take on. Like, you're leaving school, and we'll talk about your collegiate career in a second, but you leave school now sort of graduating with, a house payment for your student loan debt.
Yeah.
So it's a different bag.
Yeah. And, my experience looking back, I had no clue what the cost of education were, the financial ramifications. I had no idea what the income possibilities were. I just knew that I loved doing, I wanted to do what my dad did, which was go to work with a purpose, help patients, and have a career that was very fulfilling. And then the second part of his career, or the other major part of his career, was education. And I remember very vividly how much he enjoyed educating young doctors, young residents, giving back, so to speak, to the community. And I remember my dad just had a passion for what he did as a job and a career. It didn't seem like a job or a career to me, looking at him as a son. The other part about going into medicine is I noticed, at least my dad's specialty of radiology, we lived a very nice lifestyle. It wasn't extravagant, but we never really, needed or wanted a lot of things. Yet he was my parents were very, very frugal. But at the same time, my dad was always home for dinner. He was home most weekends. He was not in a medical specialty that did a lot of in-house call where he was gone for 1, 2, 3 days at a time. So again, my early experience of a doctor was my dad, and he seemed to have a very a great lifestyle doing what he had a passion for doing.
So that led you all, when you finished high school, to go and sort of seek out that path of going into med school. So it looks like, and correct me if I'm wrong, obviously, but it looks like you did your bachelor's of arts in chemistry at Wabash College, and you sort of left that, and then you got a master's of science in biology.
Right. So when I went to college, I was intent on being a pre-med student in college, and I didn't have much choice on where my undergraduate education was going to be.
Oh yeah.
My parents had several friends whose sons had gone to Wabash College, which is a very well-respected liberal arts college in Indiana. And I didn't have much choice, and they said you were going. And I knew that it was a great school and had a reputation for preparing students for pre-professional life. So medical school, dental school, law school,
Sure.
business school, graduate school. So I knew if I was going to go there, I'd get a great foundation and education. Interestingly, the pre-med track was very difficult and rigorous. Not knowing any better, I picked chemistry as my major because I was good at it in high school, and I had 2 years of it in high school, and had a great teacher who set a good example. But it was rigorous, and as I got into my junior and senior year, I was a good student. I had about a 3.4 GPA, which is pretty solid for a liberal arts chemistry major, but wasn't good enough to get into med school. And so
it is very competitive.
So in my class, there were 21 students in my graduating class that went to medical school, 21, and only 20 of them got into medical school right out of college. I was the lone one that did not get into med school out of college. So I took a little alternate path, and I got a phenomenal job as a research assistant at a medical device company that was loosely affiliated with the medical school at Indiana University.
Yeah.
So I lived at home. I had a full-time research assistant job doing lab research and animal research. I also took the advice of several people, including the admissions committee of the School of Medicine that I applied to, and they said, listen, your grades, your GPA, and your MCAT scores aren't good enough. And actually, the director of the admissions committee told me that I should look into another career.
Oh, wow.
That, quite frankly, fueled my fire a little bit.
I'm sure.
So I then met with the dean of the graduate school program associated with the medical school, and she said, no, you've just got to prove just that you can do the work. So I encourage you to keep your full-time job in medical research. That will help. I encourage you to take graduate level courses to bump up your GPA.
Sure.
And then you need to better your MCAT score. So I enrolled in a non-thesis master's degree program at essentially the community branch of the big universities, which allowed me to work full-time, allowed me to take graduate level 500 and 600 level biochemistry, physiology courses that were oftentimes similar to the ones you would take in med school. I also then took sort of these old-fashioned MCAT or LSAT review courses where you would go to a testing facility 2 nights a week. You'd have a lecture. You had all kinds of, hundreds of thousands of test questions you could practice on to build up my test-taking skills.
Yeah.
And then my job, fortunately, I was very involved and got to participate in a lot of different projects, got to help write some abstracts and papers and presentations. And so by the time I completed enough coursework to bump up my GPA and bump up my MCAT score, I reapplied to med school and got in. So I got in 2 years later. But during that 2 years, I was able to complete a master's degree. That wasn't the primary intent. But, took enough courses that I got the master's degree, and then was fortunate enough to be able to give some presentations at scientific meetings and things through the research. That then allowed me to get into medical school. So I'm sort of the second career path medical student, which I'm very, very fortunate and grateful to have had that experience. And my dad tells me many years later that some of his best residents were students that didn't go the traditional route, either because they weren't academically prepared or emotionally prepared or psychologically prepared for the rigors of that now avalanche of med school residency and starting a practice. So I took a little bit of a longer route, but as I tell a lot of students and high school, college, and pre-med students that I counsel or shadow with me, 1 or 2 or 3 years out of your entire career of being off path to get back on the path is nothing in a career that, might be 30 years as a physician.
Absolutely. And I'd imagine, and obviously correct me if I'm wrong, but you still were working sort of in the medical field. You were taking classes in biology, which is very relatable to even med school, and you were working as a researcher in a lab. So you were still getting experience, like hands-on actual experience, and also continuing your learning. So I would imagine that helped you when you were going through medical school.
Absolutely. It was incredibly helpful. I was taught by amazing researchers how to do scientific research, how to write scientific papers, how to give podium presentations in front of groups of large
Yeah.
scientific meetings. And yes, I had a whole lot of other appreciation for some of the other sciences that I took courses for. The other thing that was beneficial to me was I met so many other students who, like me, didn't get into medical school right off the bat
Hmm.
on their first try. And that was very reassuring because I remember almost the saddest day of my life when I got that first rejection letter.
Oh yeah.
Um, so yeah, those 2 years were extremely helpful, informative, and I think created and really helped form the physician that I am to be
I'm
today.
sure that's true. I think that when you hit those roadblocks in life, which as you now see, it's sort of like a river hitting like a roadblock. It sort of just finds a way around it and continues on its path. And there are people who figure out a way around it like you did, and people who don't. And I find that the people who figure out how to make it work are the ones who are successful in life. It's not
Yeah,
that they failed at something; it's that they learned something and then tried something different.
absolutely. And I think we certainly, those of us that had a little bit more struggles or bumps in the road are also much more appreciative of what we've been able to
I would agree with that as
achieve,
well. Yeah.
either academically or professionally or in life in general. And culturally, coming from a Chinese family background,
Hmm.
typically raised as a Chinese family, a lot of pressure with regard to academics and
Yeah.
performance. But yet at the same time, the theme culturally and in my family that never went away was you've got to outwork everybody else to get what you want.
Yeah.
So if you outwork everybody else, then ultimately you will be able to achieve your goals. So a lot of this may be innate knowledge and smarts and intelligence and photographic memories and things like that. But we were always taught if you outwork everyone,
Yeah.
you will ultimately achieve your goals.
Absolutely. So it's early 90s, you're coming out of med school. What is it that made you want to just, not follow your father's footsteps into radiology, but go into neurology?
Yeah, great question. So, as I started to appreciate what other doctors did and how they did it,
Yeah.
because I didn't have that knowledge, I realized some of the limitations of the type of practice my father had. Number one, he had very little patient face-to-face contact.
Yeah.
He was an invasive or interventional radiologist, so he did lots of procedures, worked with a lot of high-end technology, which I love, but he didn't have a lot of patient contact or follow-up. And radiologists sort of have a reputation stereotypically of being sort of introverted.
Hmm.
They like to work in a dark room by themselves and not have people around them. And as I grew up, I realized that probably is partially true. And my dad's personality kind of fit that
Sure.
stereotype, where my personality did not. So I realized that I would really be lacking in that personal engagement with patients
Yeah.
and then also the follow up. So I realized my dad would do all these amazing procedures, save patients' lives, and then he would never find out how they did after they left
Mm.
the hospital. So those were the two things that I thought were really lacking for me as I looked into a career or a specialty. On the plus side, I loved the technology aspect of radiology, and I early on formed this appreciation for technology and how it impacts healthcare and improves the lives of our patients. And the second was the technical skills. So
Mm.
I used to do some research with my dad. I used to hang out with him when he would work during the summers. I had some part-time jobs during the summers in college and during my graduate school years where I get to actually see him do his work. And so I was fascinated with just the technical aspects, the hand-eye coordination
Yeah.
of doing procedures. So I go to medical school, and as you know, the third year of medical school, you
Yeah.
start to do 1 month rotations in all of the different primary specialties and some of the subspecialties. And my dad actually was the one who gave me the advice. He said, listen, I know you think you're going to med school and want to be a radiologist, but keep your eyes open.
Sure.
Find something that gives you that passion. Don't just do it because that's what I do, or you like what I do, or you want to emulate me. And so I did that. And every rotation I went to, I tried to absorb as much as I could. I tried to critically evaluate, what I liked about a certain specialty, what I didn't like about a certain specialty at the end of every month. And then at our medical school, we had several options where we could choose between, let's say, neurology or neurosurgery. And so you had a choice. And early on, I decided, well, I'm going to do everything procedure or surgical that I can,
Sure.
because I know I want to be a surgeon or a proceduralist.
Right.
So when it came time to make my schedule for my third year medical school, I had the option of doing either neurology or neurosurgery. Well, that was easy. I'm going to choose neurosurgery to get that experience. Another example might be on obstetrics, OB. We did 2 months of OB. Your first month was delivering babies. Your second month could be delivering babies, or you could do a specialty rotation, for instance, in oncology. So gynecology, oncology, cancer surgery.
Yeah.
So I thought, well, I didn't want to be an obstetrician. So 1 month was enough to learn how to deliver babies. So the second month I chose to do the oncology, where I was in the operating room every day doing, these big cancer cases. So our medical school allowed us to have a couple of options, and I chose neurosurgery instead of neurology. And literally within the first week of that experience, just said, "Oh my gosh, this is the one for me." Even though I had many of those same experiences with other surgical subspecialties, I came very close to choosing urology, and had several meetings with the professors and the chairman of the department to try to hone in why I would consider urology or why I might not consider urology, and then ultimately landed in the neurosurgery world.
Yeah. So the neurosurgical residency is 6 or 7 years, correct?
It's currently 7 years.
Okay.
In the early 90s, when I trained, you could either do a 6-year or a 7-year residency. The longer residents typically were at the high-powered academic research institutions. And where I was a medical student at Indiana University, their residency program was very, very well known for training and educating clinicians, amazing surgeons, not as much with research and publications. And so as I elected to pursue a career in neurosurgery, I had that sort of choice to make.
Yeah.
But
So
currently they are all 7-year, minimum of 7-year, and some are longer.
And the ones that are minimum 7-year, they have a year of research, right? Which you sort of already had 2 years of research working in between, your, I guess, collegiate career and your med school career, right?
Yeah, that is true. I did 2 years of research, which included basic science research and animal research. So I was taught how to do surgeries on animals for different experiments. I believe the current residency program is 7 years, and I do not believe there's a mandatory research program. So in fact, some of the, again, high-powered academic programs, Duke, North Carolina, things like that, they actually have an 8th year. So it can be 8 years of neurosurgery residency training.
So pretty much all of your schooling has been in Indiana. So, but when you left school, did you start practicing in Indiana in like the late 90s, early 2000s?
I did. So I finished my residency in 1998. And by that time, my wife and I had been married and had a young daughter. And our goals professionally for starting my career was number one, to stay close to family. My parents and my family were still in Indiana. The second was I didn't know how to run a business of practicing medicine.
It's a different skill set. Yeah.
A totally different skill set. And in that era, got very little education, training, or lectures on any of the, the coding, the billing, the malpractice, the insurance.
Right.
So I wanted to go somewhere where I could start just being a neurosurgeon and didn't have to worry about the business side of the medicine. And so Indiana at the time was one of those states that was considered to be malpractice friendly. So lawsuits were not as frequent. The process to adjudicate patient complaints or malpractice was very fair to physicians. And so one of the biggest um, parts of practicing medicine is malpractice and the cost of malpractice. So those were my three main goals in starting a practice in neurosurgery. So that all led to sort of staying in Indiana to practice and start my career.
Yeah. So you started your career and you sort of practiced for how long before you decided maybe I should start my own practice?
Yep. So I joined a multi-specialty group in Lafayette, Indiana.
Okay.
At the time, it was called the Arnett Clinic. It was a 150 doctor group.
Oh, wow.
It also owned its own insurance plan. It owned
Oh,
its own
wow.
physical therapy, imaging facilities, outpatient surgery center. So they were very facile in the business of medicine.
Yeah.
And very quickly, over the course of a couple of years, I started becoming involved in physician leadership positions at that practice.
Hmm.
And then, fortunately or unfortunately, things happened, and there was a major catastrophic issue in the business medical community.
Mm.
And hospitals were suing our group, doctors were suing our group, and it became a time of reflection. And by that time, in a small college Midwestern town, the feeling in the community was really bad.
Yeah.
So it went from a perfect place to start a career to
Yeah.
within, 3 years, an awful place to practice medicine. So my wife and I decided to leave. And by that time, we had now 3 children by that time, all
Yeah.
young daughters. And it's a small community in neurosurgery. And when you pick up and leave and have to start from scratch, that's a huge
Yeah.
professional and personal commitment. So I got on the phone with some of my friends who were residents ahead of me, and we just started talking. And one's practicing in Atlanta, one's practicing in Tennessee, two are practicing in Tucson, Arizona, and it's a small community. So we got on the phone and talked to two of my former residents who were ahead of me at Indiana, who left Indiana and came to Tucson and joined a large private practice group. They had, the year before I joined, split off and started their own practice of 4 doctors
Uh-huh.
with a commitment to one hospital and one office. Whereas prior to that, they were in a group of 8 to 10 doctors going to 4 hospitals and 3 offices. So their lifestyle had become very, very challenging.
Yeah.
So it seemed like a reasonable fit. They knew me because of my training. I knew them.
Sure.
We knew each other personally and professionally. So I came out to Tucson for a visit. Didn't hurt that it was November in Tucson and it was already snowing in Indiana, and it was about 80 degrees in Tucson. And so we chose to leave Indiana in 2005 after being in Indiana practicing for 7 years, and I've been here ever since.
Yeah. So having gone up there, I assumed you joined that group that you went to go meet with.
I
So that's
did. I joined this group. Correct.
is that what is now the Northwest Neurospecialists, and was it then?
That's correct. So
Okay.
when I joined, Northwest Neurospecialists had been in existence for only 1 year.
Okay.
And I got the sense that they had done a phenomenal job of splitting off from the big groups, starting from scratch, a commitment to the patients on this part of town. And they seemed to be successful and had a great strategy and a plan. And I thought that was a good fit for me.
Absolutely. So shifting gears a little bit. So you came out of med school and your residency late 90s, and
Yep.
here it is 2020. So what have you seen as the biggest shift in technology or innovation over the course of your neurosurgical career?
Yeah, great question. And the first and foremost has been the transition to using minimally invasive surgical techniques,
Mm-hmm.
especially for spine surgery. As a general neurosurgeon and not having done a fellowship training, I was well trained to do the broad scope of neurosurgery for adults and even children, knowing that the predominance of the numbers of surgeries to be done were going to be in spine surgery.
Yeah.
So contemporaneously with my career starting out in the early 2000s, minimally invasive techniques started becoming more talked about, developed.
Sure.
And so I have jumped on the bandwagon fairly early in the early 2000s and have essentially converted my entire current practice to minimally invasive surgery techniques, especially for lower back surgery.
Yeah.
That's probably been the biggest or one of the biggest technological evolutions in my career so far in 20 years. And so much so that I started becoming an educator and a developer and
Oh, wow.
to
Okay.
sort of push those techniques. And interestingly, that technology is not a specific widget or a piece of equipment or anything like that. It's a surgical approach or a surgical
Yeah.
technique.
It's sort
So
of all
that's
of those things.
it's all of those things,
Yeah.
correct?
Yeah.
So that was the major driving force for technology, and then there's a couple of others.
Yeah. So in my mind, it's things like minimally invasive that make surgery. I mean, I don't know any other way to say it than just safer. It's better for the patient. It's, you're allowed to be more precise as a surgeon, from what I understand. And it makes things like wake up tests a thing of the past, maybe not minimally invasive, but things like intraoperative neuromonitoring and stuff like that, kind of in conjunction with that, makes the surgeries quicker. So, that's better for both the surgeon and the patient. So,
Yeah, no question. The minimally invasive surgery techniques, especially when they first started, we didn't know what the actual benefit was going to be. We had some hypothesis or some theories about what the potential benefit was, but clearly we've shown the benefits, and it is that the surgeries are safer, they're
mhm.
shorter, there are less complications, including infection and bleeding. There's less complications requiring further surgery, which can be expensive, utilizing a lot of resources that we may need for other healthcare projects. And then absolutely, we've become more precise
Yeah.
with our surgery, more accurate, and all of those end up in better patient reported outcomes, cost utilization, saving money, getting patients back to their normal lives, back to work much quicker than before.
Yeah. So I noticed you said something, and maybe I misunderstood this, but your dad, when you were a child, also worked with colleges. Is that correct? Uh,
I know he was a residency director, so he was
oh,
the head
okay.
of a radiology residency. So
Okay.
yeah,
So
so
he sort of ran a residency program. Is that what that
correct.
means? Okay.
That's correct. So
Because
yeah,
I noticed that you also sort of work with the University of Arizona College of Medicine. Is that correct?
that's correct.
What is it that you do at that capacity? I believe, and forgive me for stalking you on LinkedIn, it said that you're
Oh
the
no, no,
clinical professor for the Department of
yeah,
Neurosurgery. So exactly what does that entail?
right. So even though I'm a private practice, community-based neurosurgeon,
Yeah.
approximately 5 years ago, the chairman of the Division of Neurosurgery at the University of Arizona asked me to become involved in some resident education, medical student education. So about almost 5 years ago, I became a clinical or a community faculty member.
Okay.
And so while I have a title, what that means is I uh, attend conferences weekly. I give lectures to the residents. I counsel and I'm a mentor to residents and medical students in neurosurgery. I'll deliver grand rounds, which are the big lectures that we have once a month in
Hmm.
neurosurgery and neurology. And then that morphed into me doing some surgeries at the University of Arizona Medical Center and offering teaching and experiences to the residents that they don't get from some of the other faculty. So, because of my career interest in minimally invasive surgery and some of the other technological advances like robotics, I've been able to do some of my surgeries at the university hospital and teach residents those techniques to have them better prepared when they're finished with their residency.
So normally I actually close with this question, but since we're sort of on the topic of it, I'd like to ask, when someone's shadowing you or you're giving these grand lectures, and I'd imagine that some of these students come up to you, or residents, I should say, come up to you and say, hey, why did you go into neurosurgery? What advice do you have for other neurosurgeons who are just starting out or maybe still in residency? What advice do you give them when they ask that of you?
Yeah, so I get that question a lot, and
Yeah.
it can be from residents, medical students, not sure what specialty or career.
Yeah,
I
absolutely.
have a lot of pre-med students or college kids shadow me, and because I have three daughters who are in college and high school, a lot of their friends,
Oh, yeah.
reach out to me. So The first thing I tell them is, again, if you want to go into medicine, you need to be doing it for the right reason,
Hmm.
just like I was taught. And unfortunately or fortunately, part of that conversation has to go into the finances of
Yeah.
medical education, as you indicated. And not too long ago, I gave a little talk to the pre-med club at my daughter's high school. And I had to go back and prepare and find out what's the actual cost of medical school and residency, what's the average debt that students are coming out with, because I think that is an important decision.
Yeah.
As much as it is, do you do it for the right reason? Number two, I always advise them to be prepared to work as hard as they've ever worked times 10,
Yeah.
both academically and physically, the rigors of medical training. And then probably the third, which I've come to appreciate, is just kind of a conversation about work-life balance. Even as early as a high school or college kid thinking about a career in medicine, or residents who are deep in the thick of it. I've certainly learned the value of kind of work-life balance, and I know that's a bit of a cliche, but it's so important for to sustain a career,
Yeah.
especially a neurosurgical career where there's a lot of emergencies, there's a lot of middle of the night things. Some of our outcomes because of the disease processes can be really bad. And that can take a toll emotionally and
Yeah.
psychologically on not only the practitioner, but that can kind of roll over into your family. So I have a lot of conversations about work-life balance as well.
So you mentioned in sort of your answer to my last question, you mentioned robotics as well. What has come out in robotics that has sort of changed the way either spine surgery or just neurosurgery in general is done?
Right. So robotics has become a new development in spine surgery just over the last 3 to 4 years.
Hmm.
The initial early generations of robots to assist us in spine surgery only came out about 9 or 10 years ago.
Yeah.
So fast forward that 5 to 6 years of development, we now have third and fourth generation robots that we use to assist us in spine surgery, specifically for putting in screws into the spine for what's called a lumbar fusion surgery.
Yeah.
The development of robotics has allowed us to achieve precision and accuracy of putting in these screws into the spine to the tune of 98 to 99% accuracy.
Oh, wow.
With that, it reduces complications from a misplaced screw, which could result in nerve injury,
Oh, yeah.
infection, blood clot, the fusion failing and needing revision surgery, which is never good for the patient and never good for the resource utilization of our healthcare system. The second, it allows us to do a lot of our preoperative planning prior to surgery,
Hmm.
rather than planning on the fly and planning and doing the surgery at the same time.
Right.
So the robotic techniques allow us to plan almost all of the details of the surgery on a computer workstation before we end up in the operating room with the patient. And the third advantage for robotics is it dramatically reduces the use of x-rays that
Hmm.
are taken during the operation. And again, for a kind of a senior surgeon like me, ergonomics and my career span and my risk reduction for um, work-related issues is
Yeah.
important. So robotics have allowed us to save a lot of radiation exposure to the surgeon, the patient, and the operating room staff. And like anything else, it's kind of the new glitziest thing. I compare robotics to your phone technology. When the iPhone 11, whatever comes out,
Yeah.
there's a lot of hype about it, and everyone gets excited about it. It might be for the camera, it might be for the coprocessor, but at the end of the day, a lot of patients are actually asking about and want the newest technology because we believe the newest technology offers advantages over the next newest technology.
Absolutely, and that sort of plays into sort of peace of mind. If I as a patient am going to have neurosurgery done on me, whatever it is, spine or brain or wherever it is that it's happening, I want to know that the people who I'm putting my life in their hands have embraced the newest, best technology. So I
Right,
completely
exactly.
understand that. Yeah.
Right.
So you said there were two. What was the second one?
Oh, yeah. The second is in general medical education. And we touched a little bit upon that, but
Okay.
we specifically talked about education of residents at the University of Arizona.
Yeah.
I'm involved and work very, very closely with some of our industry partners.
Uh huh.
And so I'm very heavily involved in educating other surgeons, practicing surgeons, early career, mid career, late career, on a lot of these new technologies and techniques,
Yeah.
whether it's robotics and spine surgery, minimally invasive surgery. It's been a big part of my career to continue educating other neurosurgeons as they prepare for their oral board examination.
Hmm.
So to become board certified in neurosurgery, we all have to undergo a very rigorous oral board examination. And I have almost my entire career helped prepare neurosurgeons for that task with a mock oral boards review course that I participate in twice a year.
So is that something that a neurosurgeon who is looking to learn more about minimally invasive or learning more about robotics, they'll reach out to you and say, "Hey, Dr. Chua, I would love to have you sort of grill me on what the boards will be like." Is that what that process is like?
Well, that is two different processes. So one is
Oh,
just
okay.
educating surgeons to become board certified.
Ah, okay.
That's usually within their first 5 years of their
Right.
career. That's one topic. The other is the education on the newer techniques. And I work with a company called Medtronic,
Oh,
and
yeah.
a lot of Medtronic will reach out to surgeons, or surgeons will reach out to Medtronic and say, "Hey, I'd like to learn because I didn't learn in my residency.
Yeah.
I'd like to learn about minimally invasive techniques. I'd like to learn about robotics." Surgeons, Medtronic then puts them in contact with me and some other faculty members. We have courses that we put on throughout the country
Hmm.
where surgeons can come and listen to some lectures, do some cadaver work,
Hmm.
learn about the techniques and the technology. And then in this COVID crisis, we're doing tons of
Yeah.
webinars
Yeah.
for surgeon education to continue the education, even though it's virtual or online.
Would you accredit your sort of thought leadership in the space of neurosurgery to your early adoption of new technologies throughout your career? Because things like minimally invasive may have started to become online while you were learning it, while you were in residency, but robotics certainly wasn't. So
Correct.
I could see if you're just the regular neurosurgery surgery resident who finished in the late 90s, robotics might be a huge blind spot for you. But you adopted it early on and
Right.
got really into it, so much so that Medtronic is reaching out to you to help train new surgeons on it. So is that just because you've always been an earlier adopter of new technology?
Yeah, I think you hit the nail on the head. And it feels weird for me to say I'm a new adopter of technology, it's interesting because personally, I look at these things and I feel like I'm sometimes a later adopter because I let other people kind of work out the bugs and the kinks.
Sure.
But I think in general, I think people outside of my world would say that yes, Rick Chua is an early adopter of technology. He's also very humble about making mistakes, learning from those mistakes, and being able to pass on to the other surgeons who are thinking about the technologies and techniques how to avoid the pitfalls and some of the early learning issues that we did. And then the second is really, I think, goes back to my early upbringing, being around my dad, who
Yeah.
was a profound educator during his entire career, and that certainly plays a part as well.
Well, Dr. Chu, I really appreciate you taking the time today. I realize we're
Yeah,
getting close to the end of it here, but I just wanted to thank you for coming on, checking the vitals, and sort of sharing your story with us. It's been awesome. I've learned quite a bit, actually.
you bet. Thank you.
Yeah.
I really enjoy it, and I have to thank Stacy and the folks at SpecialtyCare that hooked us up and put us in touch with each other.
Yeah.